Okay, hi, here we go. I'm actually going to try to record this and see if I can post it on YouTube. And I hope maybe once I have the basic ideas well enough, then I can get back to the good stuff, which is how to tell what the sensations are and what do you do about them, what to do about wanting. Let's go. So I think most of you already know this, who are part of the MS group or the opioid group or this group, which is a transition from Second Life. So I'm a neurologist. I did my training in New York City at Montefiore Bronx Jacobi Hospital. And while I was a first-year resident there, I had my first attack of AF. I think I've told the story before. I came home to my little one-room apartment on the Upper West Side of Manhattan and had not slept in 2 days, had been on call. I got in a hot bath with a glass of scotch in my hand and went into atrial fibrillation. The next morning, I was still in atrial fibrillation, so I went to work and did an EKG on myself, brought the EKG to the ICU where I knew the residents there. And sure enough, I was in atrial fibrillation. And just before they were about to put paddles on me and shock me, I converted to normal sinus. And I have had attacks of atrial fibrillation lasting 2 to 4 days, typically a couple times a year, but in the last few years, they've been more frequent. So I decided to investigate what's really going on. Obviously, I'm a neurologist, not a cardiologist. But I pride myself in being relentless in trying to figure things out. So I've made an effort to review the entire literature on this subject, which I may talk about at a little bit at the end. But what I want to do today is I want to tell you exactly what I do. Not what I'm telling you to do, but what I do. So number one, if I go into atrial fibrillation, I immediately take a beta blocker called sotalol. There are a number of different beta blockers. For some reason, the cardiologists have determined that sotalol is better than, for instance, propranolol or atenolol. I take a standard dose, 80 milligrams. I take it every 12 hours. And I also take a blood thinner because the problem with atrial fibrillation is the main danger, besides feeling lousy and lightheaded, is that you can develop a blood clot in your fibrillating atrium. And that blood clot can break off and go into your brain and cause a stroke. So you also have to take a blood thinner. The standard one is Eliquis, 5 milligrams twice a day. And I continue to take that until I convert back into sinus rhythm. There are other blood thinners. They're all expensive as hell. Eliquis is like $500 a month. So that's a good reason not to be able to prevent AF for no other reason. In the past, my attacks would last 2 to 4 days, but now they are lasting 2 to 4 hours because of this method I'm going to describe to you. And in fact, I have had no more episodes in the last month since I started using this method that I'm going to describe here. So I purchased my own home Holter EKG machine. Any of you who have been diagnosed with atrial fibrillation or have gone to a doctor for possible skip beats will know this is a common test done. The way it's done by physicians is they give you this device to wear for 24 hours, then you bring it back into the office and they analyze it there. And then you can also buy your own device, but in general, they require that a physician be able to read it, to analyze the tracings, and also they're super expensive, thousands of dollars. So I spent the last month or so, and I found one made in China for $178. I had a pretty good feeling maybe it was going to be worthless, but I thought, well, this is important, so I'm going to go ahead and buy it. And the worst that can happen is I get to send it back and ask for a refill, or worst case, I don't even get a refill. But in fact, it has turned out to be a very good device. It's $178 called DiCare. I've written it there. M1C, there's a couple of different versions, M1C, A, B, and C. Those are all the same, made by a company in China called Dymatech, but it's sold by various medical device stores in the United States. And so if you go Google that name, you'll find it. The instructions that come with it are quite good. The quality of the device is quite good. And then in addition, I'm happy to answer any questions about it. So what do I do with this device, right? So what I do is I wear it. I wear it at night, 8 hours at night. I turn it on when I go to bed, and I leave it on all night. And it has a monitor to it, and it collects the tracing. So if I am awakened because I've had any skipped beats, any premature atrial contractions, or God forbid, any atrial fibrillation, although I have not had one during sleep, with paroxysmal atrial fibrillation, which means episodes of attacks, as opposed to chronic atrial fibrillation that happens to people who've had some kind of heart attack or other cardiac disease. They probably no point in keeping track of it at night because they have it all the time. But for what's called vagal or lone atrial fibrillation, it's more common for the attacks to happen during sleep. So I was curious as to whether it was possible I was having any episodes at night that I didn't know about. So I wear this thing at night. I'm happy to report I have had no episodes of atrial fibrillation at night, but I have had a couple of PACs at night. If I feel what I call a chest bubble. So for those who are on the Second Life program, we focus on the chest ache, which I'm going to talk about. But if you get very sensitive to paying attention to your chest, you can also sometimes feel what I call a little bubble, a little ping pong sized little twitch. And so when I have that, I immediately check for PACs using my cool little $178 gadget. I often just leave the electrodes attached to me, so I don't have to, I can just easily check. I don't have to have it plugged in all the time, but I can easily check. And then I also know how to check my pulse using what's called the Ayurvedic medicine. So I was trained in Ayurvedic medicine at Scripps Clinic. Ayurvedic is the same tradition from which yoga comes from in the various Hindu traditions. And basically it's a method where you use 3 fingers on your radial pulse. We can spend more time talking about that too. But one way or another, if you want to take it at your neck, that's fine too. If I have any PACs, when I feel my pulse or measure my pulse with EKG, I do a passive diaphragm stretch. So that's its own topic. The diaphragm, we've talked a lot about it. I love showing this picture of the diaphragm. It is a muscle inside our chest. We think of it as a breathing muscle or a ventilation muscle, but it's a much more complicated, much more interesting structure than just that. To make the simple, quick point, this section here is called the crural diaphragm. It wraps around the esophagus. OES is esophagus. It's actually, one of its functions is it is the sphincter for the stomach. People thought the esophagus had its own sphincter. It does not. Recently, it's been determined that the sphincter is actually the diaphragm, this section of the diaphragm. So what you want to do when you have a muscle that's too tight and twitching, you want to stretch it. But stretching the diaphragm is a little different than stretching your trapezius muscle or stretching your leg muscles like you see people do in their jogging outfits waiting for the light to change. It takes a different strategy because you can't reach in there and stretch it with your hands. So what you want to do is you want to have the diaphragm stretch. Here's a picture of somebody doing it, and how you do it is you press the abdominal cavity up against the passive diaphragm. So you get the diaphragm completely relaxed by exhaling. Then you suck in your transverse and oblique abdominal muscles. You suck your belly button up into your spine underneath, and it pushes all the abdominal cavities, the liver, the stomach, the intestines, up against the bottom of the diaphragm. At the same time, you contract in your throat to suck, to create a vacuum in your lung cavity, and this pushes the diaphragm up to stretch it passively. So that's the second thing I do immediately when I feel any bubbles or any PACs, I immediately do that stretch. If I'm still having PACs, if they're continuing after I've done that, and I typically do it 2 or 3 more times, then I go into what I call diaphragm stretches, which involves basically various kinds of inhaling in sort of different directions, in particular the direction of the crural diaphragm, which means a kind of inhaling, pulling back from the lumbar spine, as opposed to the standard inhalation where you expand your belly and stretch out the bottom of your ribs. You can also stretch out the crural diaphragm by learning how to contract where the crural diaphragm attaches to the lumbar spine, and you can create a pulling sensation there. And I keep doing that until the PACs stop. If I'm already gone into atrial fibrillation, I can have to keep doing that for an hour or more, but it is worth it because it will stop it. So that's what I do next. So in general, that has worked. In the last 2 weeks, in the last month, if I feel a bubble or I confirm by my pulse or with my EKG that I am having PACs, I do this Uddiyana Bandha stretch, and I do the diaphragm stretches until the PACs stop, and they do stop. They typically stop in 2 minutes, and I'm done. I do not go on into atrial fibrillation, but I'm not done completely. Next, I need to actually get my diaphragm in better shape. Like any muscle, you need to have it in shape. If all we use our diaphragms for is to keep our O2 and our CO2 within the normal range, it's not doing much. It doesn't have to work very hard. Unless you're a competitive swimmer or a competitive runner, you really don't challenge your diaphragm very much. It's very easy to keep the O2, the oxygen and the carbon dioxide in normal range. Even if you hold your breath for 5 minutes, the O2 and the CO2 stay normal. So you got to get it into shape. And that means you basically, on a regular basis, I do it twice a day, and I do it again if I wake up in the night. I basically do strong inhalations, either breathing as far as I can, or sometimes I'll hold my glottis or my lips and try to inhale to get that stretching sensation. And I try to do it in all directions, not just the standard way people tell you to do it, which is sort of by making your belly stick out, but I try to expand in all directions, the rib cage, the lumbar spine, as well as anterior or underneath the sternum. And I'll do that 4 or 5 times until I feel kind of an ache of working out. And I do that on a regular basis. I also don't sleep on my left side anymore. I discovered that when I do sleep on my left side, which is the side the heart is on, I will get a couple of PACs or at least a bubble, and I don't like that. And then there is some stuff in the literature about saying, yeah, if you have AF, don't sleep on your left side. So I don't. The other thing that's known about AF is that one of the trigger, paroxysmal AF, not chronic AF, is that it's known that swallowing cold liquid will set off AF, and it sure was true for me. From the time I was a resident until, and still, if I am tired and I suddenly drink some very cold liquid, at that first gulp will sometimes set me off into atrial fib. So I just don't do it anymore, right? To me, it's worth it. People, who are meditators, they meditate, they have a religious lifestyle around their meditation. And so this is even more important. There's a very practical reason why it's worth putting some effort into having a healthy diaphragm. So I don't mind the fact that I avoid drinking cold fluids and that I sip slowly. Okay, so in addition, going on, if I am exercising or in any way exerting myself and I feel my heart beating harder, so sometimes you don't notice. If you're doing something, even running, you might not feel a thing. But sometimes you feel your heart beating harder. You wonder what's going on. And so for me, I am concerned, could this be that I've gone into some PACs or into some kind of atrial tachycardia? So I want to do something about that. And what I do is I pant, right? So that sounds counterintuitive. Pant? Who pants, right? Dogs pant. They pant so they can evaporate water from their tongues. But what I mean by pant is I breathe quickly and shallowly almost as if I'm trying to match my breathing rate with my heart rate. Obviously not exactly. The heart's going 100 beats a minute, and I want to try to breathe at 12 or 15 breaths per minute. So, but I kind of match it. So normally speaking, if my heart rate is 50 or 60 and my normal breathing rate is 8 or 10, if my heart rate's up to 100, I want to get my breathing rate up to a higher number, say 15 breaths per minute, not to the point where I'm hyperventilating. That's why I breathe shallowly, not deeply. Otherwise, I'll hyperventilate and get lightheaded. And I'll do that, and sure enough, I can get that pounding sensation to get back down, to stop pounding in 2 or 3 minutes if I do that. I don't stop exercising, right? The goal is not to be a couch potato. That's not going to prevent AF. So that's what I do. Then here's kind of a nice key idea. If I feel hurried, I hurry. We have been taught our whole lives, especially in psychology and medicine, that being tense is bad, being excited is bad, being agitated is bad, being stressed is bad. Better relax, better relax. Our whole society is based on the idea that relaxation is good, right? But actually, I think that's a very oversimplified view that is, I think, gradually being recognized as not correct. So in prior talks, I've talked about what's called vagal predominance, or the balance of sympathetic and parasympathetic. So I do not try to relax. If I feel hurried, if I feel like I'm in a hurry, then I hurry. I don't try not to hurry. Okay. I pay attention neurotically to my chest tension. So in the second line group, we're all aware of paying attention to that because it's a very good clue to when we're wanting something. And in general, if you've had a recent breakup or heartbreak, you have a very strong chest sensation. So I pay attention to my chest sensation. Basically, it's a very subtle ache behind the sternum. It can be higher, it can be lower, it can be more broad or not. It's a subtle sensation. Ideally, you don't have it at all. But if I do have it at all, even subtly, I do something about it. I pay attention to it. If I feel my neck and back muscles are tense, then it's a pretty good bet that my diaphragm is going to be tense too. So that gives me a tip off to be particularly observant about that. When I investigate my diaphragm tensing, when I feel that subtle ache, then I investigate it. I don't just ignore it. I investigate why. I also will do the Uddiyana Bandha breathing to see if I can get rid of it right away, but I also investigate why. And usually, in general, I am unconsciously holding my breath. There's a whole literature on breath holding, which we've discussed here, and I have a bunch of slides on it. And that unconsciously holding your breath, in general, I am anticipating something I want. It sounds so vague, but it's actually very specific. Is that the last slide I wanted to cover? Let's see. So, yeah. Okay. So that is what I do. That is my program that so far is working. I have not, with atrial fibrillation, the medications are not that great. So often you end up getting gradually lulled, seduced into having surgery, ablation. It's called ablation surgery, where they put a catheter up into your heart and look for little places that are discharging, electrical discharging, and they zap them. And sometimes it does, in general, about 70% of the time it works, but sometimes they have to keep looking or go back in again to find more of these little zapping. So I am very, very happy that I have not had any atrial fibrillation since I started this program, and also I'm able to recognize the PACs and stop them within a minute or two with this strategy. And so we have this Facebook page. Please, if you're not a Facebook user, please, it's free to join. Just join Facebook and find the Healing Hurt Clinic. I think you might have to ask to join, and someone, Viri or I, will say, sure, please join us. And then I'm happy here to try to answer any other questions and pursue it further. Okay, so now I'm going to turn my head over to to the Facebook post and see whether anyone has any questions. And be careful not to have Very yell at me if I'm not paying attention. I am going to stop the video at this point, though.